I'm Dr. Lana Melendres-Groves, and I'm the Medical Director for the Pulmonary Hypertension Program at the University of New Mexico. Today, I want to start by asking you a simple yet meaningful question. How are you really feeling? If you're living with PAH, taking a moment to ask yourself this question regularly is important. Healthcare providers often see patients who do not prioritize themselves and their health as much as they should. For example, people with PAH may not speak up when they're not feeling well, potentially missing the opportunity to discuss changes to their treatment plan that could help them feel more like themselves again. Knowing this, let's revisit those substance imbalances that contribute to your PAH symptoms and explore how each imbalance can be addressed by a different PAH medication. We've learned that people with PAH typically have an imbalance in two or more of the natural substances that play important roles in keeping the lungs' blood vessels healthy. Each substance imbalance corresponds with what PAH experts call a treatment pathway. The four PAH treatment pathways are the nitric oxide, endothelin, prostacyclin, and activin signaling pathways. And the good news is that each pathway has a type of medication that can help rebalance it. To understand this better, let's take a closer look at the four pathways that medications treat. First, let's talk about the nitric oxide pathway. People living with PAH may not produce enough nitric oxide. Medications that treat the nitric oxide pathway help replace the nitric oxide that may be missing in PAH. These medications are available in pill form for patients who have been recently diagnosed with PAH. Medications for this pathway help open the blood vessels in your lungs, allowing blood to flow more easily and reducing pressure on your heart. Now, let's look at the endothelin pathway. People with PAH may produce too much endothelin. So, medications targeting the endothelin pathway help reduce the extra endothelin your body produces. In turn, these medications help open blood vessels and slow down the thickening of the vessel walls. Medications that treat the endothelin pathway are available in pill form and are often prescribed for patients who have been recently diagnosed with PAH. Let's move on to look at the prostacyclin pathway now. It's another important one. People with PAH may not produce enough prostacyclin. Medications that treat the prostacyclin pathway help replace the missing prostacyclin. This may also help open blood vessels, slow down vessel wall thickening, and prevent clotting. Finding the right dose of a prostacyclin class medication can help ensure it's providing the most benefit. Medications that treat the prostacyclin pathway come in three different forms: inhaled, pill, and infused. Many patients prefer the inhaled form as it delivers the medication directly to the lungs. Prostacyclin class medications are recommended by PAH experts for patients at high risk status upon diagnosis, or to be added to treatment plans for patients who aren't getting to low risk status quickly enough. The fourth and final pathway is the activin signaling pathway. The medication targeting this pathway helps address a complex substance imbalance. Doing so may help control overgrowth in blood vessels. This medication is available in injection form and is typically added to a treatment plan for patients who are not getting to low risk status quickly enough. This medication is often used in combination with other medications, including prostacyclin class medications.